Good evening and welcome to tonight's MIT Enterprise Forum's Innovation Forum program on 3D bioprinting. My name is Jimmy Gia and I am the chair of the MIT Enterprise Forum Northwest. How many of you are here for the first time to one of the Enterprise Forum programs? That's great. Good to see you guys here. Good to see a lot of repeat attendees as well, so thank you for coming back. And for those of you coming for the first time, I hope to see you all next season as well. The MIT Enterprise Forum, we are a global organization of 24, 26 some odd chapters across the US as well as across the globe, dedicated to entrepreneurship and supporting innovations. The local chapter here, we're comprised strictly of volunteers, and for this particular program, we have to thank Grace Augustine, Anthony O, Chris Black, Ben Keller, Paul Meehan, Adam Schuster, Annie Way, Kyla Young, and Alyssa Zumadilova. Will you please give them a round of applause for putting together tonight's program? And I have to say, as a volunteer myself, I've been involved now for 9 years in this organization in various different capacities. Where you learn the most about a particular topic or technology area is by being a volunteer and working with the speakers to put the program together. And it just so happens that next Tuesday at the Pyramid Ale House, we'll be having our volunteer mix and mingle, where we'll be connecting new volunteers, old volunteers with the positions that are available for the next season and the programming teams that will be coming up for the next season. And so please come to that. It's a great way to become involved and a great way to learn about all the different topics that we do over the course of the year. None of this program would be possible without our sponsors, so thank you to our season sponsors, T-Mobile and Artifact, our program captain, Stokes Lawrence, and in-kind sponsors, Freelock Computing, Puget Sound Video, and the MIT Club of Puget Sound. And also for this program, thank you for a partnership with both the Harvard Alumni Club as well as the Babson Alumni Club. So to kick off then, tonight's program on 3D bioprinting, our first speaker is Kelly Stevens from the University of Washington. She's in the professor of bioengineering pathology, and her work is in building organs from stem cells. So looking forward to what that means and how that works. Thank you.
Well, thanks very much to the organizers for the opportunity to speak here today, and thanks to all of you guys for coming. My lab is working at the University of Washington, and we're essentially trying to assemble new human tissues from stem cells or organs from stem cells, and also, which I won't talk about today, but if you want to hear about some other time, remotely control those tissues after they've been implanted into a patient. And I've been asked to sort of broadly introduce the whole field of 3D bioprinting to you, so I'm going to sort of step back a little bit from my normal spiel about my own work. I'll give you just a tidbit later, and just say, wow, look at what we can do. I mean, we're tech people, right? We all want to build Yoda. So essentially what the field of printing is allowing us to now do is turn digital models on a computer, 3D digital models, into real world objects. That's really the basic gist of it with a printer. And there's a variety of printers and there's a variety of objects. I just want to give you a little bit of a sampling. We can make doggy prosthetics. We can print cars. We can print clothing apparel. We can print musical instruments. And I'm going to let HBO, actually Westworld, give you a little bit of a feeling for some of the other things we might be able to do. What if we could print a human eye?
The coward dies 1,000 deaths. The valiant taste of death but once. Of course, Shakespeare.
So the basic concept of 3D bioprinting then is, can we solve some of the most critical problems that are facing human health with 3D printing? So for example, organ failure. 18 people die every day in the US alone while they're waiting on the organ transplant list. Can we build them a new liver, heart, lung, kidney, eye? Infectious disease is a staggering global health burden. Can we somehow impact that with 3D printing? I'll give you a little bit tidbit how we're thinking about that. Drug development, currently one estimate is that it takes about $5 billion for every single new drug that's going to come to market. maybe 3D printing can help us solve that problem. I won't touch on that today, but some of our other speakers will. So one of the things that we're working on in my lab anyway, just to give you a little bit of a zoom in now into one or two specific areas that we could be working in, is in this area of organ failure. Can we actually help a patient that has a failing organ and build them a new organ? As one example, which is one of the areas that I work in, liver disease. The liver is actually a truly amazing organ. I mean, I'm completely biased because it's where my research is. But it's a truly amazing organ because it actually, if you cut out 2/3 of my liver or anybody's liver that's sort of a normal, healthy liver, most of you guys in the audience, that your liver would actually entirely grow back within just a couple of weeks. Now, that's not the case if you've had a variety of insults that would give you chronic liver disease, which is called cirrhosis. That could be due to a number of insults like alcoholism or a variety of infectious disease conditions or fatty liver disease, whatever. It leads to this essentially really diseased liver, and it causes 1 million deaths per year, and we could help these patients potentially. And so one of the things that we're trying to do in my lab, and a variety of other folks are also working on, is saying, can we literally build a liver in a dish, and then can we transplant that liver back into a patient? So give them a satellite liver that would give them back some of the functions. So the liver is a really complex organ. Yes, it is as complicated as it sounds. One of the biggest hurdles in the field actually is that the liver has actually 500 functions, and all of those functions are supported by a cell that needs to be fed with blood from blood vessels. Okay, so here I'm just showing you a picture of essentially the blood vessels that feed the liver. Okay, and what I hope you can take from it is it's really complex. And so one of the goals of 3D printing is to say, can we print the blood vessel networks that would then keep the cells in the liver alive and functioning? Okay. So can we take the liver, can we potentially image a patient and understand what their blood vessel network looks like, put it onto the computer, and then run it through a printer and literally print the blood vessels in that liver. Then we can cast the cells that do the functioning around those blood vessels, and voila, we have a functioning organ that we can transplant. Okay, maybe it's not quite that simple, but you kind of get the dream. This is the pipe dream, we're not there yet. And so one of the things that we've been working on is saying, can we print biocompatible materials that cells can live with, and then essentially encapsulate them together into this sort of 3D format. So we started by trying to literally print the cells, like put them through a printer nozzle and see if we could get them to survive, and we killed all of the cells. These are living human cells. They don't like being put through a printer, right? So we said, okay, let's take a step back. Blood vessels are literally sort of perfusible channels. Can we somehow just figure out how to make perfusible channels? And we decided, what if we use an inside-out approach? Okay, so what if we can take a printer, and instead of printing the cells themselves, what if we can print sort of the infrastructure upon which those cells can lie? And we realized that, and also it has to be compatible with cells. The cells have to live with it. And we realized that people love sugar. And also sugar has this sort of capacity to retain its 3D structure, right? So a good colleague and friend of mine who's now a professor at Rice University is named Jordan Miller, and he came up with this formulation of sugar that you can essentially print. I'm just going to show you the printer here.
Allows the sugar to keep its own
Turn
structure.
this off, actually. I'll talk instead of Jordan talking. And basically what we use is a 3D extrusion printer, and you can literally just print the sugar into a variety of networks. You can imagine if you can print your complex sugar network, you could then take the sugar network of a variety of geometries. You can then put your cells in a gel around that sugar network. Okay, hope you guys are following me here. And you can then flush out the sugar and flush in human blood. Okay? And so now all of a sudden you have this thing that's perfused and can keep these cells alive. Okay? And I won't go on to show you all of the scientific data and stuff, but it does keep cells alive, and we can make something that sort of seems like a human liver. Of course, we're only sort of there, and it will take a while. In the meantime, we've also been trying to figure out how can we actually print the human cells. And this has actually been a remarkably challenging problem for the field, and part of that's because of not the concept of the hardware of the printer or the software of making the digital model, so not the printing, but actually the ink that you print with. That's been a major challenge for the field. I think you'll hear about this more from some of our speakers. But so actually what we started to realize was, what if we use nature's ink? So can we take literally human organs, or in this case it's pig actually, and we grind them up. We remove all of the cells, and you're just left sort of with the cells, with the goo that would support your cells. And now you're left with goo, which is a bio ink, which we can put cells in and actually successfully put through a printer now. So it turns out that cells like the goo that they're normally surrounded by, and maybe that's not so surprising. So we're now starting to make progress towards actually printing the cells themselves with this development of these new bioinks. And we're also starting to test whether or not if we can print these tissues in the conformations that might be more nature-like, that we would see in nature. We can make big tissues, we can make little tissues, and we find that when we print the tissues in particular conformations, we can implant them into animals, and we start to get tissues that are actually better functioning tissues than we would have been able to do without these sort of advanced fabrication approaches. So here what you're seeing is actually cells that we have genetically encoded to literally emit light with a firefly protein when they're functioning. And so what you see here are more functional cells in these mice compared to less in these mice. And these are just different conformations of tissues that were implanted. So this means this is better. So organ failure is one area. I promised infectious disease is another area that we're also starting to consider. You guys have heard of malaria. The global burden of malaria is extremely high. There's no vaccine available. Drug resistance is emerging. And from the liver's perspective, malaria is actually a really interesting problem. So a mosquito injects the malaria parasite into a patient. It goes into the bloodstream. It hits the liver. It lands in the liver, multiplies 20,000 times, and then it bursts out of the liver cell and back into the bloodstream again. So this liver stage is sort of a bottleneck of malaria infection, okay? So he said, well, what if we can use biofabrication techniques such as, for example, 3D printing, and what if we can make a human organ that we could then infect with malaria? So one of the problems, as you can imagine, is hard to study human malaria. And so we said, what if we can make this sort of human in a mouse version as opposed to just doing mouse studies? So here, the glowing is actually the malaria parasite itself has been engineered to glow with the firefly protein. And so what you see over here is that when we infect our mice that have our engineered human liver tissue with malaria, we get infection in that human tissue, just like we would get infection in the mouse liver. And actually, I should say this is a mouse version of malaria, so it does infect both the mouse and the human liver. If we had a human version, we only see infection in that human liver. Okay. So with that, I hope that I've sort of convinced you of some of the potential areas that this type of a concept could be used in, 3D bioprinting. And we have a whole line of speakers, so I'm going to let them give a little bit more about their work. And I just want to acknowledge, before I go on and announce those speakers, the folks in my lab that did some of this work. Most of my bioprinting work is done by Gina Zhang, who is over here, and also Daniel Corbett, who is right here. And I already mentioned Jordan Miller here, who developed the sugar concoction and actually a lot of the printing hardware and software that we're working with every day. And with that, I'd like to just move on and introduce some of the other folks that are going to be speaking. So Sam Wadsworth is the Chief Scientific Officer of Aspect Biosystems, and I believe he's going to be coming after me here. And then Al Nelson is an Associate Professor of Chemistry at the University of Washington. And I think he's not here yet, but he'll be... He walked in, great. Awesome. So we might flip that order, then I'm not sure. You guys decide. Chris Howard is the Manager in Tech Commercialization at Seattle Children's Research Institute. And finally, Ivan Owen is the Makerspace Lab Manager at the University of Washington in Bothell. So welcome to them, and I'll just hand it over to Sam. Okay.
Well, thank you very much, Kelly. And thank you to the organizers for the invitation to present to you today, particularly Chris for, I know, putting in a lot of effort to make today happen. Yeah, thank you for the invitation to speak to you today. I've come down from Vancouver, Canada, where I work for a company called Aspect Biosystems. Aspect is a spin-out company from the University of British Columbia, And we spun out some novel technology about 4 years ago. And I'm going to tell you about how the vision for this company has grown. And really the best way to illustrate that vision, I think, is to start with a story. And this is a story set in the future, and it's a story about myself. So let's go 40 years into the future. I'll be 80 years old, and I've not been feeling too good recently. So after my daily game of space tennis, I've been feeling kind of tired. And I lost to a 110-year-old last week, and that's never happened before. So I'm feeling kind of concerned, and I go to see my doctor, and my robo-doc scans me up and down and gives me the news that I have a disease called idiopathic pulmonary fibrosis. This is a progressive disease of the lung, and the only cure is a lung transplant. And without a transplant, my estimated life expectancy is only about 5 years. Now, in 40 years' time, this kind of diagnosis won't concern me. And it won't concern me because this is what will happen. Some cells will be taken maybe from my skin or from my blood. They will be grown in a laboratory where they'll multiply and they'll be reprogrammed to become lung cells. Once there's enough of those lung cells, they'll be put through a machine called a bioprinter, which will build a structure that resembles a human lung. That lung will be grown for a few more weeks in the lab, and then it will be implanted into my body, where it will replace my old diseased organs. Now, the beauty is that the cells that are in that lung will be my own cells, and so there will be no need for me to spend the rest of my life on anti-rejection drugs, and I certainly won't have to wait on an organ donor waiting list until a suitable organ becomes available. So that's the vision that we have at Aspect. And I'm going to tell you today about how we're working towards making that vision a reality, but also about how we're able to produce things right now that have a real use in the life science industry. So Kelly did a really good job of giving an overview of kind of 3D printing and also bioprinting, so I won't belabor the point, but most of you are probably familiar with this sort of desktop 3D printer. It uses molten plastic, which is laid down layer by layer to build a three-dimensional structure. And we're not just restricted to printing molten plastic. We can print metals. The automotive and aeronautical industries are printing metal parts for their machines. And recently there was even a 3D printer on a large scale that could print quick-setting concrete, opening up the possibility that perhaps we'll be printing the houses we live in, not just plastic models of houses. Bioprinting is different. Bioprinting shares some commonalities with traditional 3D printing in that we take a software design for a 3D structure, and that design is realized layer by layer to build that three-dimensional object. But that's really where the similarity ends. Because instead of using plastics or other synthetic materials, we use a combination of living cells and biological scaffolds to generate these living structures. Now, gone are the days where you can sit in the corner of a lab and just develop a technology by yourself. Bioprinting is really an interdisciplinary effort between scientists in a whole variety of different disciplines, including cell biology, materials science, tissue engineering, and various other engineering disciplines as well. So it's a really interdisciplinary effort to drive this technology forward. What we've done at Aspect is take some of the advances that are being made in those different areas, and using a unique biofabrication technology, we're applying that technology to different areas. And those areas include things like drug development, regenerative medicine, personalized medicine, and cosmetics testing. So bioprinted tissues have a variety of different applications in different industries. So on the left-hand side of this slide, you see really the beating heart of our bioprinting technology. It's a microfluidic chip, and that chip is about the size of a USB stick. And what you can see is that on that microfluidic chip, there are multiple different channels. Each channel contains a liquid that's a different color. And what we're able to do is basically switch between the different channels as we print. So what comes out of this chip is a single fiber. And that fiber is about the width of a human hair. So what we do is we take that fluid on chip, we cross-link it very rapidly, and I'll go through how we do that in a second. But we cross-link that fluid, turn it into a solid fiber that's about the width of a human hair, and that fiber contains living cells. Those fibers are laid down layer by layer to generate a three-dimensional structure. And what you see on the right-hand side is a tube-like structure where we're switching components in between different layers. And so you can imagine that if this structure contains cells, we could basically build a structure that contained different cells in different regions. So this illustration basically shows how we generate that fiber. And I'll go through it at a fairly high level. Basically, what we have is, on chip, we have the ability to generate these multiple channels that contain a pre-polymer. So that's a material that's a liquid which can be turned into a solid very rapidly. Surrounding that material, we add a cross-linking fluid. And that cross-linker surrounds that central material and turns that central material into a solid gel. And so what you see on the right-hand side is a cross-section through that cross-linked material. And so you have the surrounding sheath, which is the cross-linking fluid, but in the center, you have that material which is turning into a gel. And so that material is focused into that very fine fiber. And so this all happens on chip. So we can take these pre-polymer materials, we can add cells to those fluids, and we can cross-link them into a fiber that's a solid gel on the chip. And it's that fiber that's then deposited out of the chip to build that three-dimensional structure. One of the advantages of this particular technique is that when you push anything through a small channel, it's exposed to shear stress. And for cells that are being printed, shear stress is a killer. So they really can't withstand any kind of shear forces. And so particularly when you're trying to print things quickly, when the shear stress increases, you end up killing a lot of the cells. With this technology, the cells are protected from the edge of the channel by that sheath fluid. So they're not exposed to hardly any shear stress at all. And so we can print cells very quickly and keep them alive. So it's a novel technology, and we're the only people that use this kind of printing technology to do bioprinting. Now, on the left-hand side of this slide, you can see a photograph of what this cross-linking process looks like. So the dark material in the center is our cell-containing material that's being focused by the cross-linking fluid coming from the outside. And so you can see that material is kind of being focused into that very fine fiber right before it's being deposited. And we can control the diameter of these fibers. And that's important when we're trying to make cells perform in certain ways. When we restrict them into very narrow fibers, they behave differently to when they're printed in larger fibers. And so by controlling the pressures on that chip, we can control the width of the fiber. Because we can switch between materials as we print, we can also code those fibers so that they contain different materials at different regions along the length. Here in the center, you can see a fiber that's loaded with two different colored dyes, and we can switch rapidly between the blue dye and the yellow dye as we're laying that fiber down. Now, when we're using cells, those two regions would be two different types of cell. Again, showing how we can pattern different types of cells very, very finely in our three-dimensional structures. What you see at the bottom of this slide is a close-up image of one of our fibers where we're able to cease the flow of cells. So we have some cells, these are actually hepatocytes, these are liver cells embedded within the fiber, and we can basically switch that cell off and continue printing the fiber with a cell-free region. So we can switch between a cell-containing region and a cell-free region. We can also do other manipulations of fiber architecture, including producing these fibers called Janus fibers. A Janus fiber is where we have two different materials within the same fiber. Basically, we can split them down the middle. So in this case, we have a red dye coming down one half of the fiber and a blue dye coming down the other half. Again, this could be two different types of cells within the same fiber. At the bottom of this slide, you can see something called a core shell fiber. Again, this is where we have two different materials in the same fiber, but now we have a core that contains one material. In this case, it's blue dyed beads, and they're surrounded by a shell that is of a second material, this time containing green fluorescent beads. Now, these core shell fibers can also be hollow, so we can generate hollow fibers. And as Kelly was mentioning, producing blood vessel networks within these tissues is a real challenge. And so potentially being able to print hollow fibers is one way to get around this problem. So we can print a variety of different shapes of structures. You saw a tube being printed earlier. We can print concentric tubes, so we have different materials within different regions of the same layer, producing structures like blood vessels, for example. And on the right-hand side, you can see a membrane sheet that we've printed that basically resembles a skin-like structure. So potentially we could produce bioactive band-aids that contain living cells or bioactive molecules. So a variety of different structures can be generated using this technique. Now, my story started with a lung disease, and I showed you how we can print some fairly complex three-dimensional structures, and even down at that fiber level, that human hair width fiber, we can control the contents of that fiber in some pretty fine ways. So can we print something as complex as a human lung? Well, the answer is not yet, we can't. And there's a very good reason for that. It's a very complex organ. Similar to the liver, it's this intricate branching network of airways. And to give you some idea of how complex this structure is, each of those airways branches continually until it ends in a tiny air sac called an alveolus. And it's at that alveolus where gas exchange occurs. Now, there are 300 million alveoli within each lung, so it's an incredibly complex structure to try and recreate, and we're just not capable of doing that yet. But we can print pieces of the lung that have some use, and I'll describe how we do that. So this is a fluorescent image that shows the muscle fibers that wrap around the human airway. Now, if you have asthma, when you breathe in an allergen and you have an asthma attack, it's these muscle cells that contract, they reduce the diameter of your airways, and they restrict airflow and cause you to wheeze, and you have an asthma attack. So we can take those cells from the muscle that surrounds the airways, we can grow them in the lab, and then we can print them into tubular structures similar to the one that you saw being printed earlier. And this is one of those structures looking down from above. We call it a bioring. And I'll show you how these biorings can be used in a useful way. Now, the specific use for these tissues isn't for implantation. They're not a transplantable tissue. These tissues can be used to help the drug development process. And there's a very good reason why the drug industry is interested in using these kinds of tissues. So it's currently estimated that it takes about $3 to $4 billion to develop a single drug and take it to market, and about 12 years of development. So it's a very expensive process, and it's a very time-consuming process. Now, one of the reasons it's so expensive is because of the high failure rate of drugs that enter clinical trials. So drugs that show promise in the lab, and these drugs are tested on cells grown in petri dishes, they're tested on animals, they show promise in those preclinical tests, and then they move into clinical trials. 9 out of 10 of those drugs that enter clinical trials actually fail, usually because they just don't show efficacy against the disease, so they don't cure the disease. Sometimes they're downright toxic. And those are things that weren't spotted in the preclinical stages of testing. Now, each of those drug failures costs about $200 million, so failure is very expensive. Now, what we propose, and a lot of people are getting on board with this, is that if instead of using just cells grown on a petri dish or a mouse to test your drugs, if you can build a three-dimensional structure that contains human cells and acts like a human organ, and you test drugs on that, then the data that you get from that will be much better at translating to the human that you're trying to get the drug to work in. So the translatability of that data should be much improved, and the failure rate of drugs should be much lower. So this is a way of improving the efficiency of the drug development process. And we're working with pharma companies right now to use our tissues to test their novel drugs that are coming through their pipeline. So as I mentioned, the tissues we print are living. They contain living human cells, and those cells have to be grown in an environment that reproduces the conditions inside the human body. When they're first printed, the cells are individual spheres, but over time they spread and grow and form these interconnected networks. And those tissues are functional. So this bioring tissue that contains those muscle cells contracts in response to histamine and relaxes in response to an anti-asthma drug, salbutamol. We call it an asthma attack in a dish. I'll play that again. So as I said, those cells are viable, they spread over time, they interconnect, and they form a living tissue. So that 3D printed structure has become a living tissue. Now, histamine is a compound that's released in your airways when you have an asthma attack, and so that's the compound we use to trigger contraction of those muscle rings. Salbutamol is a drug that's in your Ventolin inhaler if you're an asthmatic, and so that's the drug that we were adding to trigger these tissues to relax. So we have a disease-relevant response and a drug-relevant relaxation response. So you can see how you could use this tissue potentially for disease research, but also to test new drugs against asthma. This slide's quite busy, but I'll go through it at a fairly high level. Currently, the gold standard for testing asthma drugs is something called a precision-cut lung slice model. Now, the PCLS is where you take either a piece of human lung or a whole mouse lung, and you fill it with a gel, and that gel is called agarose. And once all of the airways in that tissue are filled, you then take, and you let it gel, you then take sections through that tissue. Those sections can be put onto a microscope slide, the gel is melted away, and if you're lucky, you may have a cross-section of an airway or two in that tissue. What you can then do is add drugs or compounds that trigger contraction, just like we did in the bioring, and you can image that tissue using a microscope and basically video those airways within the tissue contracting and relaxing. Now, the precision-cut lung slice is a great model in some respects. It's got all of the cells of the airway present that you need to do your study, so it's a highly physiological model, but it's very labor-intensive. It takes a lot of time and effort to learn how to do this protocol, and it's also quite difficult to get hold of fresh human lung tissue, unsurprisingly. So it's a model that has a lot of limitations to it. And so really our thinking with this airway version of the bioring was to print something that was much more convenient. And it takes roughly 30 seconds to print one of these bioring tissues, so it's a very rapid process to build the tissue. And then the measurements that we use to test the tissue are basically the same as the ones that you use to measure the precision-cut lung slices. So researchers can take our tissue and basically perform the same studies that they would use normally. On the right-hand side of that slide, you basically see a couple of graphs, and those graphs are basically they show data from our contractile tissues. And what we do is we measure the area of those rings, so we look at them from above using a microscope, and as they contract, we see a reduction in tissue area. And so the graph on the left-hand side shows a reduction in bioring area, so that's a contraction in response to increasing concentrations of histamine. And on the right-hand side, you take pre-contracted tissues and then hit them with increasing doses of salbutamol, and you see a dose-dependent relaxation, so they relax and expand in response to the drug. So that's the kind of data we get out of these tissues. This table basically shows numbers that compare the the precision-cut lung slice models with the BioRing tissue. And suffice to say that the sensitivity of the printed tissues are actually very similar to the fresh tissues that you can get from those slices. So we have a very physiological model of contraction. This technology is broadly applicable, so we've used it not just to print these primary human lung muscle cells, but also a variety of other cells as well. And they include dermal fibroblasts, so cells from the skin, liver cells, cells from the blood vessels, and also some immune cells as well. So we've basically used this technology to print a variety of different cell types and shown that those cells are viable and can grow in the tissues that we print. So we have worked on building other types of models as well. At the top here, you see data from a printed liver tissue. So this is a hepatocyte cell line. These are the cells that Kelly was mentioning that do all of the jobs of the really important jobs in the liver. And one of those functional readouts that you can get from these cells is release of a protein called albumin. And so we measure albumin release over the course of about 3 weeks, and we see that in those printed liver tissues, we see secretion of that protein. And so those cells are viable for several weeks in culture. The tissue you see at the bottom is one where we're trying to reproduce a cancer tissue in the lab. And here we take a design for a tissue that contains a tumor, a group of tumor cells in the center, and healthy cells surrounding that tumor region. And so this is a way of basically programming a tissue where we can look to see how the tumor interacts with its surrounding environment. And that's very important when you consider how tumor cells migrate and metastasize around the body. So those are some applications for this kind of technology in drug development. Obviously, a big interest of ours and a focus now is generating tissues for implantation. One of the first tissues that we're focused on in regenerative medicine is the knee meniscus. Now, the knee meniscus is a focus of ours. Why? Well, it's because it's one of the most commonly damaged areas of the knee joint. It's estimated about 66 people for every 100,000 in the US have a damaged meniscus. Now, when you're an adult, the meniscus has a very poor healing potential. So if you tear your meniscus, often it can't heal. Now, it used to be thought that if you just removed someone's meniscus or just surgically took out part of it, then that was good because it got rid of the acute pain. But actually, in the long term, it's been shown that a lot of those patients develop osteoarthritis of the knee joint. So there's a lot of interest now in developing replacement options for the meniscus. And so we recently went into a deal with Johnson & Johnson to develop a replacement knee meniscus. And here's a video of one of these tissues being printed. So I should say, before I print this, we're right at the start of this project. And so this isn't going to be our final tissue, but it's an example of the kinds of things that we can print. And it starts off with an image of the computer design of this meniscus tissue. You can see it looks kind of like a crescent shape. And so that's the tissue that we're going to print. Okay, so you can see that software design of the tissue. It's basically a CAD model. And then the printer is laying down these tiny fibers, and we're orienting the fibers in specific directions. And the orientation of those fibers are essential to give that whole tissue very specific mechanical strength. So that tissue has to be strong in compression and it has to be strong in tension. And so we have to align these fibers in specific patterns to basically confer those different mechanical strengths to the tissue. What we also do is we don't just develop tissues in-house, but we're also working with academic collaborators using our technology. And so our goal is to basically get multiple groups around the world using our systems and developing novel tissue applications of their own. And this is an example of one of the bioprinter machines that we're producing right now. It's not just printers that we sell, but also there are very specific consumables that go along with them. And really the only one I want to mention is the bioink. So the bioink is the scaffold that surrounds those cells as we print. And bioink it's a very tricky material to produce because oftentimes you have to customize that bioink for each specific cell type that you want to print. And so a lot of our time and effort at Aspect is spent developing and optimizing these different bioinks for different specific cell types. We're working with a variety of different academic collaborators right now using our systems. And I just want to give some examples of the types of tissues that they're working on. So there's a group in Nevada who are going to be using our system to generate contractile tissues, but this time uterine smooth muscle cells. And they want to look at uterine contraction and how it's relevant in premature birth. There's a group at Manitoba who are again building contractile tissues, this time of the airway, but also vasculature, so looking at blood vessel contraction in hypertension. And then finally, there's a group at the University of Victoria on Vancouver Island who are interested in basically developing 3D printed neuronal tissue, so printing nerves that could be used to model neurodegenerative diseases such as Parkinson's, but also potentially generate nerve tissue for implantation. And so as a company that's in this bioprinting space, we really see this kind of ecosystem that's developing around the technology. And that ecosystem consists of biotech and pharmaceutical firms who are interested in developing new tools to develop drugs in more efficient ways, academic collaborators and academic researchers who basically want to generate new tissues to investigate diseases in different ways, funding agencies. These are very important. In Canada, we have access to slightly different funds than you do down here. But federal funding, provincial funding, and also private funding is essential to kind of help startups like ours really find their feet and get going. And then finally, regulators need to be involved in the discussion as well. So Health Canada and the FDA, they're really interested in this kind of growing bioprinting space and how these printed applications may have applications not just in drug development, but also in transplantation. So having that conversation with the regulators early on is also important. One way that we can kind of build this ecosystem is by bringing all of these people together. And so just a couple of weeks ago, we co-hosted a meeting up in Vancouver where we brought together members of the pharmaceutical industry, members of the academic community who are developing this printing technology. We even had people from bioethics and IP lawyers in the room to discuss just how bioprinting can be adopted by industry, but also the kind of societal and ethical impacts that it may have in the future. And so we're hoping that this will be an annual event from now on. And so if any of you are interested in attending this next year, please contact me. And so finally, I'd like to say thank you to the team at Aspect, but also a big thank you to the various funding bodies we have, NRC, IRAP, NSERC, and the Stem Cell Network as well. So with that, thank you very much, and I'll take any questions.
So thank you very much for having me this evening. My name is Ivan Owen, and I work for the University of Washington's Bothell campus running a makerspace over there. In addition to that, outside of my day job, I'm a member of an open source community that develops assistive devices with a particular focus on upper limb devices. I had the opportunity to speak at the Enterprise Forum about 2 years ago. So some of you may have heard some of this before, and this will be a bit of an update. I'll be talking about this to kind of explain the field of what is becoming open source printable prosthetic devices, and I'll explain my background in it as it's a good example of how people come into this from, let's say, fields that one wouldn't necessarily expect. And that's a common theme that's been occurring. And then explain where I think that this might fit in terms of a more mainstream medical context in the near to not too far out future. So I won't go over 3D printing tech again, but just, there's a lot of different varieties, and it's used for a variety of applications. So it's great to be at an event where this is being discussed in detail. But specifically, the type of printing that we've been using in our community is fused deposition modeling. And so that's what Sam referenced, where it's a liquid plastic that's being extruded. And one of the interesting things about these machines is that they can retail at a fairly low cost considering what they are. So when this technology was first released in the mid 80s, you would pay about the price of a house to get an FDM printer. Now, after various patents expired, the machines are being built by a very wide range of retailers at varying levels of quality. And so this is what our community uses. We're really focusing on the lowest tech end of 3D printing and looking at what sort of impact it might be able to have. My particular background is interdisciplinary art and music. And more specifically, a lot of what I do falls into practical special effects. So think terrible stuff for low-budget monster movies, you know, the really cheesy kinds of effects. So you know, these are some of my examples of past projects, making weird instruments, playing with fire a lot, you know, carefully, hopefully. And building stage prop gadgets. I'm really happy about this one, mainly because I actually really admire and respect the actor who's from Modern Family, but I basically got to punch him from thousands, not thousands, hundreds of miles away, because I built a prop that they used in there. So that was fun. I didn't know what it was being used for when it was purchased from me. They just told me that they wanted it the next day. But one of the props that I made that got me involved in printed prosthetics is this hand. So this is a armature that would go inside of a costume. The puppeteer wiggles their fingers. It makes the monster fingers move. I posted a video of this online. It was seen by a gentleman who responded to the video by sending me an email with this photo attached. Basically saying he was trying to build his own prosthetic device because his insurance wouldn't cover it. Incidentally, because he still had his thumb, they deemed that his hand was still operational enough that they wouldn't pay for the mechanical fingers that were on the market at the time. This was in 2012 when he sent me the picture. So we collaborated using the magic of low-cost, very powerful communications technology that we have access to nowadays. So Skype, email, sending video clips back and forth. Here you can see some diagrams that he sent to me. And we used components that we could both find at our local hardware stores. The catch here is that he is in South Africa, and I'm here in Washington State. So we had to kind of shop around and compare notes on what we both had access to. One of the things we found is that here in the US we have the Erector set toy. There they have Meccano, but the dimensions are all the same. So we ended up using a lot of parts from those toys. After about a year's worth of development over the web, we developed this just single finger design that could be built in a home workshop using fairly commonly available materials, but still took a good degree of craftsmanship to put it together. So not exactly an accessible device. And I ended up with the opportunity to actually fly over there to work with him in person. Around the same time that I was getting ready to leave, we received an email from the mother of this little guy. His name's Liam. And he was born without any fingers but a functional palm and wrist. And again, sort of a common theme here. Lacked the adequate medical insurance to obtain, let's say, a standard device. So the challenge was put to us by his mom to see if maybe while I was over there and we had all of 3 days together in person, if maybe we could develop some sort of device that took the single finger we developed and create an entire set. So that's the task that we took up, and in the space of that time over there, we developed this pretty crude device, actually. I mean, in terms of where it interfaced, we used thermoplastic that's used in making orthotic splints, but the function of the device was pretty limited. And the catch on this was that he was going to outgrow it very rapidly, at the same pace that he would outgrow shoes. And it took us quite a bit of work to produce it. At that time, somebody suggested to us that we might want to look into 3D printing. I made what I think was one of the weirdest pitches I've probably made in my life, where I contacted a 3D printer company's customer service division and asked them for 2 printers for free because we didn't have a budget, but explained what we were up to, and thankfully they said yes. That was MakerBot. They're now owned by Stratasys, but at the time they were still a smaller independent company. And we used, I found a completely free and open 3D design package that I was able to learn by following tutorials online, things like YouTube videos. And with access to these printers and using free software, we developed our first printable design. It was a huge jump from what we were doing previously, because we were able to automate a lot of the parts of the manufacturing using this very low-cost machine, and also just get down to a lot of our materials cost was from the hardware that we were using. So we had this device. We had the files for it available, and they could be rescaled as Liam grew. So the decision was made to take our device and put it into the public domain and put it on a website where it could be downloaded for free, in the hopes that this might lead to other individuals hopping on board and maybe making them for other people, or making them for themselves, or developing it further. So this is a screenshot of that. And we didn't have to build the website. That's the other wonderful thing. We used a free site called Thingiverse. So there's a lot of sharing of files going back and forth happening for all sorts of things, like the Yoda head that you saw earlier. That's one that you can just go and download for free and print on a printer. At this point, we didn't have any sort of formalized structure for people to collaborate with one another until this gentleman, John Schull from the Rochester Institute of Technology, came along, and he thought, well, maybe let's make a Google Plus group and people can start talking there. And he set up a map where people could put their pin on the map and say, hey, I'm here and I have a 3D printer, or hey, I'm here and I'm looking for a 3D printer, and start to communicate with each other that way. So that's how the Enable group was formed. I was thrilled to see somebody doing that, so I hopped on board as well as one of the early founding members. And by January of 2014, this is the map we had, and every pin that you can see there is a member of the community, either a volunteer, somebody seeking a device, or a printer, a designer. There's lots of different roles that people volunteered for. And this also became a hub for iterating upon the design and working together. And like myself, we had people in that mix that weren't classically trained engineers. We did have engineers. We had medical specialists. We had the device users become members of the design team. We also had hobbyists and artists, and it was a pretty broad range of disciplines coming into the mix. With this distributed development, you can see the timeline moving from top row starting at the left and going along of the rapid and significant improvements that were made to the device. And a lot of these came from contributions of the users themselves. And I'll get to that a little bit later as to highlight one of the unique aspects of using these low-cost systems. And another thing, sort of a side note to mention, is that kids became involved in learning to assemble the device and also becoming designers in the community. So teachers started using this as a model for education in some of their classrooms around the world. So from January of 14 until pretty recently, we'll look at the change to the map. This is where we're at as of March of 2017. And so if I go back and forth between these, you can see a lot of new activity in Central and South America, starting to get into more areas in Asia, slowly reaching places in Africa as people gain access to low-cost 3D printers. We're hoping to see this trend continue to move in that direction. For those that would like to learn more about this project in particular, we do have a community website. It's enablingthefuture.org. So that's a place to go, and you can. There's links to all the different designs. There's information on stories on what's happening in different places with this. And I think one of the most tangible benefits to this kind of R&D was that in the space of about 2 years, we ended up cutting the material costs down to a third of what they were previously, moving more of the manufacturing towards an automated process, which reduces labor, et cetera. It's important to note with all of this, as far as these costs and time, this is still not as good a solution as what you could get from a prosthetics clinic with insurance. These devices aren't as durable. Their function is quite limited, but this is an accessible option between nothing and needing to find a pathway to being able to afford about a $3,000 to $5,000 device, which is what you're looking at if you're going to be privately paying for an upper extremity limb through a clinic, unless you can go to a nonprofit, receive it for free, or have insurance. One of the really interesting aspects of this has been the end users themselves driving development. It's fantastic when somebody's using one of these and they look at it and they just say very plainly, this part here sucks. And they're right, because they're the ones that are using it and they have that knowledge. And normally it would be a difficult process to get them to become a designer in something like this. A good example is, this is Shay. She thought the hands were pretty neat, but she wanted one that could actually hold a violin bow, and the hands, as they were designed, weren't good at that. So she worked with some folks at the University of Wisconsin-Milwaukee. They had a lab there that was interested in working with her, and they came up with a device that does nothing but hold violin bows, and it does it really well. It does that one thing. Now, and it can be made for cost estimate on that one, depending on the printer you're using, is maybe $10, $15, because you're going to need to get some Velcro maybe, and that's estimating pretty high. And because she developed that, it's now available, and other kids besides herself are using that design. Another kid was inspired by her design and said, well, hey, I play trumpet. So similar sort of development went on there. Two of the community's most prolific designers are Peter Binkley and Peregrine Hawthorne. Peter's the dad, Peregrine's the son. Peregrine is, he used to actually live over in Bremerton, so he was local. And he wanted something that was much more robust, and he's not going to outgrow it, so they could use more expensive materials, that sort of thing. So they incorporated Peter's knowledge of leatherworking and jewelry smithing to make a hand that used leather for some of the components and was able to withstand more weight, these other sorts of things, and they also made their design open. So a very common theme. And sort of moving towards the future for the community, now some of our community members are getting access to things like laser cutters, other technologies, and they're pushing it even more in the direction of, I'm looking, you know, if they're the person stepping forward, they're going, I'm looking to make something really specific. And normally that would be a very hard undertaking to do, but a good example is, this is Emma. She's a puppeteer in Ireland and wanted to create a device specifically for puppeteering because she's always doing the crazy things like getting up on stilts and enacting various characters and needing to control things in a particular way. So she and a team developed something using a laser cutter and wood to produce this device specifically designed for puppetry. She has an arm, but her left arm, due to an injury, has very limited function. And so this she describes it as she puppeteers herself to move her arm to then in turn control puppets. It's a pretty cool thing. And you can see there's some of its function there. So it kind of goes all over the place. Where the community's at now and where I think it's transitioning to is that now what's happening is groups are breaking off and forming sub-communities in specific areas where they're then looking at how to best distribute devices where they're at. This map represents everywhere that somebody's formed a local enabled chapter, and then they are working they set up their own social media sites, they reach out to local government in some cases, and they're working to kind of push it forward where they are. Great example from that is Paraguay. They're an enabled chapter in Paraguay, and they've developed kind of a prosthetics co-op. So individual device users will come in, and it's a pay whatever you can model. So some of them just receive one for free. If they can pay, they pay in. And then they've had some of their device users become volunteers and then go on to learn how to be essentially hand mechanics, let's say, and then develop solutions for other people seeking devices. So it's been really cool. And they're just one of many chapters that are now exploring how to do this in different areas. There have been some commercial ventures that are a part of the community. where they're developing much more advanced limbs. So Open Bionics is a company based in the UK. They are creating myoelectric robotic limbs, and you can buy a kit from them, but you can also go and download all of the design files, the code, and they have a parts list so that you could build one yourself if you would like. Another example is XE in Japan. They haven't gone to market yet. They do have a very ambitious goal of they want to produce a design that can be available through clinics at $1,000 or less. And again, they've also published all of their work open so that you can replicate it yourself if you speak Japanese, because currently their instructions are only in Japanese. So I have to put that caveat in there. So I think what all of this means as far as where this might find its way into, let's say, more mainstream medicine, because this is all happening on the periphery, and it's hard to scale it and it's hard to make it sustainable, is I could see this going towards physical therapy and occupational therapy clinics, because they already build things for their patients on a regular basis. They build custom objects and they have the approval from the FDA to do so. So one of the things I've been working on is starting to work with some rehab clinics for physical and occupational therapy to help them learn how to use this technology, maybe even get them access to 3D printers so that they can then develop, automate some of the things they're already building. And not only that, but then have an easy way to share it with other clinics. There's already some designs out there that they can start with experimenting with, because the community had a design challenge where the challenge was, hey, try to come up with ideas for things that people with very limited hand function could use, maybe due to stroke or other injury or ailment. And the community responded by developing some of these solutions that you can see here, all of which can be printed for less than $3 in plastic using the low-end 3D printers. One of my favorites is this tool that is just for opening Tupperware containers, or converting a round handle into a lever style, or converting a round faucet handle into a lever style faucet handle, these sorts of ideas. And if you see on this file sharing website, these are all responses to that challenge. The ones that are blue can be downloaded for a small fee. The ones that are green are all available for free download. So the norm, it seems, is that people choose to just share these solutions openly. Here locally, a high school senior for his senior project worked with Seattle Children's Hospital and made a device for holding things like drumsticks and guitar picks for their musical therapy program. And likewise, he has uploaded this device, so it's available. I like his solution because it's modular. You can, once you've printed the base, you can just print different attachments for different instruments. So that's where I think that this could find its way into that sort of realm of medicine, and there might be ways to grow that potentially so that clinicians can then share back and forth, iterate upon each other's designs, and sort of recreate what's happened, let's say, out in the wild in a more controlled setting. Personally, I'll be working on this with these entities in the near future, and perhaps more down the road. And I look forward to speaking with all of you later. Thank you.
Thank you very much. It's been a great discussion so far, so I'm happy to be able to contribute to this today. But what I'm going to do is talk about a different scale. Okay, so I'm a chemist. I'm from the chemistry department at the University of Washington, and so I want to take this down to the molecular scale and talk about what we would think about with respect to materials that would go into 3D printing. And what my group focuses on are materials that respond to external stimuli. So this is a picture of the group and sort of an overview of what we do, but in the purple circle there, that kind of talks about the types of polymers we're interested in. I'm not going to go into a lot of details about that, but what we do is we design these polymers at the molecular level, and then we try to use those for particular types of purposes. And that's what I want to focus on today, is really using these polymers for the areas of living materials and also for 4D printing or shape morphing objects. And what ties all of these projects together for us is 3D printing. So we see 3D printing as an important enabler in the work that we do. So I'll take this back to the molecules, right? And on this slide here, what I show is sort of the spectrum of molecules that you might think about. So on the left-hand side, what you have is the simplest, smallest molecule that you might consider, so something like methane, right? It just has one carbon. But as you proceed along to the right, we're adding carbons, right, to that chain. So we get these longer carbon chains. So as we go from methane, which is at room temperature, is a gas, and we start to add some carbons to that. So if we have a 3-carbon chain, that's propane, right? That's still a gas. Make that a little longer. So we have a 7-carbon chain, it's heptane, it's a liquid, right? Make that a little longer, so we get a wax, so that's actually a total of 20 carbons. So the brackets there represent 18 repeating carbon units. And then, so we're getting to a waxy material. We're only talking about just using carbons and hydrogens, right? And then if we get to an even larger molecule, so where we have a subset there, a subscript N, and say N is 1,000, or several thousands, or hundreds of thousands, then we get into polymers. Okay, so these are very, very long chain molecules. So, but as a chemist, though, I have to think about what the composition is, right? We have the whole periodic table of elements to choose from, right? So which ones do you use? And that turns out to be really important because for the hydrocarbon chain that I showed on the previous slide, that's polyethylene. And so we know that polyethylene has a lot of number of different uses, whether it's as for plastic bags or for implants or even for the rims of plastic bottles. But if you were to replace all the hydrogens of that polymer with fluorine, now the properties have changed entirely. Okay, so now what you have is Teflon, right? So great for making floss. It's great for coating pans or nonstick pans, but also Gore-Tex as well are actually Teflon fibers. Okay, so changing the atoms that are in the molecule significantly affects the properties that you observe at the macro scale. All right, so how do we tie this into 3D printing? Well, my view of 3D printing and bioprinting is that there are 3 components to this ecosystem. Right, so first you have the hardware. So this would be the printer, the motors, right, that drive the printer, the computer as well. And then there's the software and the modeling. And this is an important part of what we have nowadays to enable bioprinting and 3D printing. But this concerns computer-aided designs, but really creating that virtual object. And combining that with the hardware, you're able to translate things from the virtual world into the physical world. Right? And I think that's the real power of what we have in our hands now, and that you can imagine something crazy like a pug with wings, right? And you can create that in the virtual world and actually turn it into something physical. Now, the last part of this ecosystem are the materials. And, so the materials that go into 3D printing, I think for most of the parts that you see, are off the shelf. Okay, so these are materials that have been around for 40 or 50 years, but they are primarily developed for a different purpose. Right? So they were developed for melt extrusion, right? For melt processing and molding plastics into different shapes. So now we're talking about 3D printing. That's entirely different. And so what we have now is the opportunity to think about, okay, how do we design the materials to enable better 3D printing? How do we design materials to give you the sort of mechanical properties that you need in the end after you've 3D printed some product? So let me just give you a sense of the type of materials that we're interested in. We're largely interested in hydrogels, so just a slide to introduce this topic here. But hydrogels, I think a classic example would be something like Jell-O, but you find it in a lot of foods. Also, baby diapers are great hydrogels because they absorb a huge amount of water. And so that's what all of these materials have in common. So these are polymers or molecules that can absorb a significant amount of water. Okay, so we're talking about materials that are 60, 70, 80, 90% water. And just to kind of remind you, you probably already know this, but 60 to 80% of your body by weight is water as well. And so I like to put this in a different way, in that for every 100 pounds of body weight that you have 60 to 80 pounds of water. Okay? So what that means is that in the absence of our bones to provide structure, are really just walking hydrogels. So for that reason, it's important to think about hydrogels as an important fundamental topic to explore. Okay, so I won't go into too much detail as to how we print it because it's very similar to what we saw earlier with Sam's presentation, and I'm sure Kelly referred to this earlier as well, but we have an extrusion printer. Okay, but what we do with our gels is that we put them into a syringe and we extrude it through some nozzle by applying some pressure. So the hydrogel itself goes into the syringe. We use some external pressure to extrude it from some nozzle, and we print it at room temperature. We create some three-dimensional object or structure, and then in some final step, we use a very brief UV cure to cross-link the structure to make sure it holds its form. So when we think about designing our materials, there are three important components here. The first is that we want materials that are temperature responsive. And so I'll get into why in a second here. But our materials are also pressure responsive. That's how we can extrude it through a nozzle. And then finally, our materials are light responsive because in that final step, we want to make sure that the printed structure can hold its form. Okay, so I think this is my last slide where I actually show a chemical structure. All right, but there are two different platforms that we are developing. Okay. There's this structure on the left, structure on the right. Both of them are what we describe as tri-block copolymers. So these are linear polymer chains that have three segments to them. And what we like about these tri-block copolymers is that they do make hydrogels that are stimuli responsive in the three ways that I mentioned on the previous slide. Now, the material on the left is just based on a commercial material called F127. So this is a surfactant polymer that's used in a lot of shampoos. It's used as stabilizers for drugs. It's used in drug delivery. So we can take that commercial polymer, we do one synthetic step, and we have our printable material. But the polymer on the right is something that we've been developing in our lab. And the reason that we like this polymer is that if you compare the two structures here, we have a much greater opportunity for introducing other R groups onto this polymer. What that means is that we can introduce other types of atoms, other types of molecular groups onto that polymer, and that allows us to change what these polymers do in their hydrogel form. Okay, so let me get into some of the specifics as to how these materials behave. So first I want to just focus on the temperature response. And so in this video here, so what you have here, you notice is a vial. It has our hydrogel inside. So our postdoc Abi shows that if you invert this vial, it's a gel. It's sticking to the top of that vial there. But he's going to stick it in an ice bath. Okay? And after about 4 minutes here, you'll see in that digital clock, some time has lapsed. He's going to take that vial out, and he's going to show that that gel can flow. Okay, so this is a reversible process. So what we have is a gel at room temperature that melts when you cool it down. Right. It seems kind of backwards, right? Because usually you heat a gel up to melt it, but this is the opposite here. But this is what we see as the advantage, okay? So the reason why this happens is because, and so he's showing now that we're back at room temperature, it's a nice gel again, okay? So the reason why this happens is shown in the cartoon scheme that goes along the bottom of the two pictures there. So starting on the far left-hand side there, what we have is our tri-block copolymer. It's a linear structure, but what's important is that there are three segments there, the blue, the red, the blue. That red segment there changes its solubility in water depending on temperature. So when you cool the solution down, that red segment is water soluble. So these polymer chains are water soluble, and that's why the solution can flow. But as you allow the temperature to warm up, that red segment becomes more hydrophobic. It's going to start to expel water. And when it's hydrophobic, it causes the polymer chains to assemble into these micelles. These micelles further pack, and when they pack, that's when we get our gel. Okay? So this is a self-assembly process at the nanoscale that gives us the thermal properties that we have here. Now, the reason why that we like this feature is because there are two reasons. One is that it allows us to incorporate additives into our hydrogels homogeneously. So if we want to incorporate cells, if we want to incorporate other nanomaterials, other polymers, we cool our solution down, we put that additive in there, we mix it up as a solution, Bring it back to room temperature, we have a homogeneous gel. Now, the other reason why we like this temperature response, and I think this is more for the students than for me, is because it makes the loading of the cartridge a lot easier, right? Because what we do is we cool that gel down. It's a liquid. We pour it into the syringe. It's a lot more civilized way of doing it rather than trying to jam a gel into that same syringe. So the second response that this hydrogel has is that it's pressure responsive. And so what I mean by that is that it shear thins. Okay? It's a lot like toothpaste. Where toothpaste, it's a gel in a tube, and the reason why it comes out is because you apply that pressure, and when you apply that pressure, the viscosity of that gel changes, right? So it comes out of the tube, but as soon as it comes out of the tube, it doesn't feel that pressure anymore, right? And so that's why when the toothpaste comes out, it holds its form. It's that nice cylindrical structure. It's the same thing with our gel. Okay, so when we apply pressure, it shear thins. It changes its viscosity, but once it exits the nozzle, it's a nice firm gel again. And then lastly is the light response. So what we do is we incorporate molecular groups into our polymer just at the ends. This is represented by the orange segments there. These are known as methacrylates. They undergo polymerization in the presence of radicals. So in the presence of a photoradical initiator, we can induce the polymerization of these groups, and that's how we can fix the structures of the gels. So we've printed a number of different types of structures using this process. So starting from the upper left-hand side there, that's just a stacked grid, right? So we are using this layered structured approach. We can also make composites. So the top two images on the upper right there, the browner version is actually graphene oxide that we've incorporated into our gels. You see that it looks transparent, right? So that's very indicative of uniform distribution of graphene oxide throughout that hydrogel. But we can also load carbon nanotubes as well. So the black structure there has been loaded with about 4 or 5% by weight of carbon nanotubes. And that's within our hydrogel. The red cone there, just to show you that we can make structures that don't need to be supported, and so we have developed other processes that allow us to do that. But just before I move on to the next slide, you'll notice that there's a green grid on there. So that is a hydrogel that's been loaded with algae. And the upper cube that's held by the tweezers has been loaded by yeast. And so let me tell you why we're trying to put algae and yeast into our hydrogels. Okay, so I lied. There are a few more structures here, but just a quick test. So what do these molecules have in common, right? So penicillin, paclitaxel, insulin, ascorbic acid, whiskey, acetic acid, acrylic acid. So what do these molecules have in common? Well, they're all produced industrially using bacteria and yeast. Okay, so industrial scale production of all of these molecules happens using cells. Right, so we're not making these molecules from scratch using petroleum products. We're actually using cells to do this for us. So all the insulin that's produced in the world comes from yeast or bacteria. Right? All the antibiotics that we take come from bacteria and yeast as well. Okay, so what we want to do is to think about how can we use our supported structures, our hydrogels, to use these types of cells in catalysis, right? So, we have sort of the old school reactors of, using these large vats, right, where you have the cells stirring in solution, right? Over time, 3 or 4 days, you bring everything down, you isolate the product. But what we want to think about is maybe a slightly different paradigm, one where we can use our cell-embedded hydrogels as catalysts, supported catalysts. And so the concept here, as shown in this cartoon, maybe I'll just use my pointer here just to help guide through here this scheme. But the idea is that we have our hydrogel lattice, and we embed yeast or bacteria within our hydrogels. And if we feed yeast glucose, as an example, well, it's going to eat that glucose and it's going to produce ethanol, right? So So in the short term, what we hope is to be able to fabricate these types of structures using these types of cells to produce different types of useful products, right? And the idea here is to take advantage of the more recent advances that we've seen in synthetic biology, where we're not just using yeast to make ethanol now, but we're using yeast to make other biofuels or even other drug molecules as well. And in the long term, what we'd hope is that we can actually place these different lattices in series so that each lattice could be responsible for one chemical transformation. So at the end of the day, we come in with one input, have 3 different transformations occur, and then have one output at the end. So this is just an SEM image, just to give you a sense of what the hydrogels look like in the absence of water, right? So we freeze-dried the sample in liquid nitrogen, removed all the water, and this is just to show you the porosity that exists within the hydrogels. And so there are fairly large voids here, and this is where we would expect the cells to reside. So postdoc Abi here is now just showing just casting a structure by hand, okay? And ultimately, what he's able to do is to create these fairly large mesh structures that look like this, okay? So this isn't 3D printed using a 3D printer per se. It's more, just a mechanical motion thing of your hand. But the result is very similar, that you can create these 3-dimensional lattices. And so what we're demonstrating with these 2 images here is that there's an elasticity to it, right? So these are fairly robust structures. You can hold them in your hand, but you can also put yeast cells into these hydrogels as well. And so here with these 3 images, we're showing what happens over time, starting from day 0, where we have the single yeast cells existing or locked into the hydrogels, and then over time, watching them grow colonies within the gels, right? So in fact, the yeast are quite happy existing within our gels. So now if we take one of these printed cubes with yeast and we submerge it into a solution containing glucose or sucrose, then the yeast are quite happy to transform all of that sugar into ethanol. And so the conversion there is quite efficient, on the order of 94% conversion, and that happens in about 12 hours or so. Okay, so 12 hours is not a short period of time, but it's quite reasonable. But we think the additional value is that the yeast are still alive after 12 hours. And so if you take this cube and you put it into a fresh solution of sucrose or glucose, then they're still active. They keep going. And we're at the 60-day mark, and the yeast are still active and they're still going. And so the value then is the fact that you can preserve the yeast within these gels and have them be active for long periods of time. Okay, so we've looked at a number of other cellular systems as well. So I mentioned algae, but we've also been looking at bacteria, and we're trying to understand how we can control different populations of bacteria to have very similar effects of doing multiple transformations. But what I want to do now is to move on and to talk about 4D printing. And I saw Sam kind of mention this with his lung model, which was actually very cool, right? And so we're not putting cells into our structures, but we can have actuation based on the design of our structures. So the idea of 4D printing is that you have some 1, 2, or 3-dimensional object that changes shape, changes chemically, or changes in some way over time. And in fact, we don't really live in a 3-dimensional world with 3-dimensional objects. We're in a 4-dimensional world, right? Our bodies are constantly changing. Everything around us is changing in some way. And so we are quite inspired by this sort of actuation that you see in a plant. Right? So plants don't have motor proteins. Yet, we can see a plant open up in the morning, right? Or we can see them change their orientation relative to the position of the sun. So in the absence of motor proteins, how do they do that? Well, they use swelling with water, okay? And so in this cartoon, on the left-hand side, this is a cell wall, and so we have the cell that in its shrunken state, but through osmotic pressure, these cells can inflate and exert some pressure against the cell wall, right? And it's that exertion of pressure that can give cells their rigidity. But it can go beyond just the difference between a wilted versus a fully healthy plant. But if you're familiar with Venus flytraps or these mimosa plants, as is shown in this video here, even this actuation is controlled by the flow of water. Right? So the actuation that you can see within a plant, based on water flow or osmotic flow, is fast. So there are a couple different mechanisms or ways that you can have this type of swelling. So maybe in the simplest approach we have is what's shown in this upper left-hand side, where you might just have the difference between a dry sponge versus a swollen sponge, right? So it just expands in all directions the same amount. But then you can start to get curvature within that structure by having some sort of pH gradient in solution, or having two different materials that swell to different extents in intimate contact with each other. But we've come across something slightly different that involves anisotropic shape. And so what I mean by that is, so given these two examples here, I'm just going to start with the one on the left. So this is a 10-arm star where we have these arms emanating from a central core. What's important is that the top surface and the bottom surface are different, right? The bottom surface is flat, top surface is curved. And so what that means is that when that structure swells, it's not going to swell uniformly in all directions. That bottom surface is larger than the top surface, so that's going to swell more. And so what happens then, when we put this printed structure into the water bath, it starts to actuate. It starts to fold. Right? And the rate of actuation for all the individual arms is uniform, right? Because they're all of the same length and the same curvature. And so what we've been doing is looking at different designs to control how we can print structures that will fold in different ways. So now, if we have these diagonal slats going across these horizontal bars, then we get a helical structure. Right? And so there are ways to mathematically describe what's going on here, and we can actually now predict how structures will fold. And now just to tie this back to the temperature response that I talked about earlier, right? So we have the gel that melts when you cool it down. Well, that temperature response is not turned off when you have a printed structure. That lives on. So what we have in these two videos here are identical structures, but two different water bath temperatures. So cold water on the left, warm water on the right. And so in that cold water, these structures swell a lot more, so we have a lot more curvature, versus in the warm water where they like to tighten up and we get a much more rigid structure. So just a quick slides to wrap up here. So, you know, just thinking about where 3D printing and bioprinting is now. So, you know, I think the idea of the hype curve always comes up, and I think it's very true. You know, so for those of you who have not seen this, what you're plotting here is time and looking at visibility over time. So at the starting point here, that's when the technology is identified. And so, of course, you know, as you go along with time, there's the peak of inflated expectations. And then once those expectations are not met, then you enter the trough of disillusionment, right? And then over time, you go through the slope of enlightenment and the plateau of productivity. So, you know, this discussion's come up earlier. 3D printing's been around for a long time, and it's hard to tell where we are in this curve. Right? What we hope is that this time around, that you know, we are here. Right? And I think based on some of the talks that we've seen already today, that you know, you can have a lot of confidence that you know we are in this regime here, and that we're going to see real productivity coming out of a lot of these recent advances. But you know, as much as we've seen already, I still think that there's another important component here, and that's that new materials are necessary to create the new opportunities that we're going to see at the end. Right? And this goes both ways, because even with the new opportunities that are being presented, you're going to need new materials, right? And so with this, we hope that the work that we're doing is going to fit into this type of relationship. All right, so just to conclude then, so what I've done is just to give you an overview of our materials interests in making hydrogels, but we can make those hydrogels for doing catalysis using cells, right? Taking cells' innate abilities to take molecules and transform them into something else. And then also some ideas with 4D printing, right? So creating objects that are that can change in shape over time based on their extent of swelling. So I do have to thank the people who did a lot of this work. So they are listed here. And I also thank you again for the invite and you all for your kind attention tonight.
So my name is Chris Howard. I'm a Manager of Technology Commercialization at the Seattle Children's Research Institute, and I act as a custodian, if you would like, of a new program based out of the Research Institute called the Imagination Lab. So I'm here to talk to you a little bit today about the applications of 3D printing actually in hospital settings with an emphasis on Seattle Children's. And I also recognise that I stand between you and leaving, so hopefully this is going to be worth hanging around for a little bit. I'm going to start quickly with a tech overview. So we got some good background on the bioprinting, and then Ivan talked a little bit about the FDM process, but there's actually a number of other processes which have applications for many other different types of work, many other types of work that are done in hospitals. We talk mostly about patient-specific models because that's really the meat and potatoes now and the most aesthetic use of 3D printing in hospitals, and then a little bit of product development design work that we do, and then point of care production, which links back to what Ivan was talking about earlier with his hands. So no conflicts or disclosures. I work in a research institute, so it's one of those things I'm expected to say. Terminology, 3D printer, kind of there. Machine used for 3D printing, which is not terribly helpful. And then additive manufacturing, the process of joining materials to make parts from 3D data, usually in layer form. And again, that's what you've seen a lot of with the talks that have been going on here, the interaction of layers. But then from the bioprinting sense, instead of it actually being 3D printing, it's more like 4D printing because the prints actually evolve over time. The other interesting thing here is that you're getting an ISO ASTM definition of this. It also, what that really means is that the industry, if you would like, is starting to mature, at least from the industrial perspective of making manufactured metals and plastics and things like this, as the aerospace and automotive industries are starting to buy into additive manufacturing in a serious way. And the additive manufacturing companies start to go after the $1.2 trillion of manufacturing value that they see here. The standards and the groups that are around us have started to become increasingly important to ensure that we have consistency and competitiveness in the marketplace. So I'm a big additive manufacturing nerd, basically. I love this side of things, and the bioprinting stuff is awesome as well. Start with the most, the top, I think I've got 6, yeah. 6, can I count? 5, no, I can't count. Patient-specific anatomical models are the most common use. Those are your 3D printed skeletons. And just so you know, I'm working off a Google PowerPoint presentation, so things don't go quite as smooth as they would look like. That's not intentional. Patient-specific assistive tech. Again, Ivan's covered that really nicely. Product equipment assets, product equipment research and apparatus design. We're not really going to touch on that too much, but there's some of that that's on the table out the back. Replacement parts for medical devices and other pieces of equipment. That's another part of the industry which is quite contentious right now. And then finally, there are the broken parts, essentially, that we find in the hospital that could be replaced quite easily with additive manufactured parts. And then finally, your tchotchkes, if you would like, that are very useful for pediatric institutes that talk about what we do and help people remember who we are. So we're going to focus on these 3 for this talk because we don't have very long. And so if I also move pretty quickly, that's why. There are 7 approximately current families defined by ASTM of additive manufacturing. We've got vat polymerization, so that's your stereolithography type processes. Binder jetting, that's essentially what it looks like, ink onto a powder. Powder bed fusion. Sheet lamination. Sheet lamination is interesting because it's essentially a laser cut piece of paper or a vinyl film which is laid down layer by layer by layer. So very, very cost effective. It's not common, but it's very interesting properties. Material jetting, which is the object Stratasys technology, which is still under tight patent and therefore very expensive. Material extrusion, which Ivan's touched on a little bit about. Deposited energy deposition. So essentially firing powder and lasers and things like that into metal to make them melt. and then finally the hybrid of all of these. So you can package all of these together in many different ways, and then you can also add CNC machining, so computer numerical machining, robotics, on top of that to make it work. Of those 8, we are going to focus on 4, and really of those 4, some of them are much better suited to different types of manufacturing in hospitals. So vat polymerization is your standard, it's like I said, stereolithography. The biggest upside is it's very cheap now. You can get polymer printers for just under $1,000, and you can get materials for just over $60 a litre. And you can get them in a range of materials. The downside is that you see all these support structures that are essentially here. That's where you're starting to run into difficulties in post-processing. So post-processing is one of the hidden issues of additive manufacturing, which is you have to remove these supports in order to create a usable part. The upside, though, is you can actually create very beautiful models, and the models are watertight, which means you can pass gas and you can pass air through these things. So you can use them as functional prototypes, and with some of the newer polymers and printers coming online, you can actually use them for production-grade parts. Binder jetting is a form of essentially ink printed onto powder. So you could take your HP printer and then pass it over a layer of talcum powder, and essentially that's binder jet printing. It allows you to create all kinds of crazy structures, but the advantage is you don't have any support material other than the powder itself. It also allows you to recycle the powder, which means it's an incredibly cost-effective process. You can add ink colouring to the powder as well, so you can produce very high fidelity, attractive models. The big downside, though, is that they're quite brittle. So what you see with the models that are out on the table there is they've been hardened by adding an infiltrant, so a liquid superglue, if you would like, or a wax or an epoxy to make them durable. Materials jetting, that's essentially like inkjet printing, except instead of printing ink, it prints liquid plastic or polymers. This is the Stratasys technology, which is, I think, still under patent and very expensive as a consequence, but produces beautiful parts and very, very high fidelity models. So if you're thinking about how this would be used for a patient-specific model, if you were looking to learn about the anatomy of this patient, you've got fantastic resolution within that model. You've also obviously got the color and the fidelity, and now that you can do multi-material digital prints, so you can actually start to get texture where you can poke and feel this thing. It's not quite there from a materials perspective and representing human anatomy, but it's close. And then finally, material extrusion, and I think Ivan's covered that quite nicely. Biggest downside, though, is that you actually do need to produce support material, much like stereolithography, and you're limited to the speed and extrusion rates of the printer. So binder jetting and material jetting are going to be the key technologies you want to be thinking about for producing patient-specific models in a hospital. This is all pretty standard stuff if you're around the business long enough. However, these 4 are your key issues that are relevant to manufacturing in hospitals. Manufacturing complexity is free. Essentially, it's very difficult to CNC a piece of vasculature that's incredibly precise. It's just not possible. So really 3D printing opened up this whole field of patient-specific modeling. Unlimited design space. So again, you can print things that are upside down that shouldn't be possible in nature or in real life, or in a computer even. Variety is free, so you can essentially switch between patient models with a click of a button. One printer can produce many, many different pieces. And then the precise physical replication, which is you can actually hold in your hand what you have created from the digital model from the patient's images. So what you're looking at in your hand, if it's carefully produced, will actually be what's inside the person. There are other things, we just skipped through all of these, but they're related to just additive manufacturing in general. When it comes to 3D printing limitations in hospitals, just like I talked about with the with the inkjet processing, the materials don't accurately represent tissue at this point. It's great to see some of the work that's coming through with the bioprinting, because this offers the opportunity to create electrically conductive models that could be used to simulate cardiac anatomy and changes that would be made prior to actually going into the operating room, rather than just making the rubber models that we have out there, making them palpate, things like that. Strength and durability is entirely dependent on process and the expertise of the people operating the machines. This is a big challenge to regulators and law enforcement, just in general as an industry, but also specifically in that relates to medical devices and counterfeiting and importation of deregulated or unregulated devices. And then essentially when it comes to producing parts at the hospital in order to replace parts in your devices or in the devices of, say, the bioprinting machine. I don't know. The problem is that patents don't actually cover parts, generally speaking. They cover mechanisms and utility. So it's very difficult to protect against counterfeit parts, and there's a big push in the industry to how that's managed in general as well. So this is where we're going to spend the bulk of the talk, and we'll probably just, depending on how we're going from time, we're going to move through. So there's a couple of videos here. This build's a bit funny. We checked it out earlier. So the way this process starts is you collect your imaging data, which is essentially the person is fed into, I shouldn't say fed into, glides into a beautiful CT machine, as the one here from Boston Children's shows. You could also use, so CT is computed tomography. It's a form of radiation-based imaging, and then there's magnetic resonance, which is essentially a form of, I believe, I don't know, where they excite hydrogen ions and measure very, very small changes, beyond me. However, those two technologies for imaging are the workhorses of the patient-specific modeling process, because they create essentially what's called a DICOM image, or a DICOM data set, which can then be converted into a 3D volume-based model for analysis by the radiologist and by the clinical team. When you start to come to segmenting, the next step is you pull that imaging data that's collected from the CT machine. We're going to stick with CT as a simple process. And you pull it down into some special software which can start to eliminate all of this residual material and residual data, if you like, and focus on what's important. So if this was a bone model that we'd be making, like some of the skeletons that we have out there, you'd be focusing on just using the threshold to pull out where the skeleton is, and then you can essentially discard much of the other material. It then feeds into some other very expensive, generally speaking, software that's usually regulated by the FDA. There is open source software out there that does this, but there is a question about whether or not you would want that in a medical process. Legitimately, like it's a very interesting argument about whether or not you spend $15,000 a year on a license so that you can have access to this, or do you run an open source software platform? It's interesting, and there's certainly a lot of controversy in the industry about this. Anyway, create your 3D model. Behind there, you'd see the two printers that we have. One is the Form 2 by a company called Form Labs. They produce a really nice 3D printer for about $3,000, and then you have what is the Z-Corp printer, but is now a 3D Systems printer that produces a binder jet powder processed model. Next, you get into post-processing, so you'd be removing the support material that you see on the right-hand side, and then you'd actually, in some cases, if you were making nasal models or making patient models using the stereolithography process, you would start to remove the support material. And again, the careful removal of the support material or the careful removal of the powder is actually critical to making sure that the models last. And then finally, you deliver it to the clinician. So this is a nasal airway of a premature infant that was created, and then this is a multicolour body model that was created for a kid with severe scoliosis for the orthopedics and sports medicine team. So here's why you might use this, and this is going to link back to a case that recently came through from CNN. And I saw this when I was at a conference last week, and I thought it was a very extreme but very interesting example of how this technology can be used. It doesn't mean that it's only used for exclusively complex cases, but this is just a fantastic example of how this can be used. So Jaden and Nice McDonald were going through craniophagus surgery, which is essentially, obviously, they're conjoined at the head. This is a very rare event, and essentially there have been less than 60 cases of this in the US since records have really been kept. So 1952, there have only been, I think, 57 or 52 cases. Dr. James Goodrich and Orpin Tepper were the surgeons who led this, and it took place at Montefiore Medical Center. Surgery time was approximately 16 and a half hours, but that was just for separation. The actual total surgery was over 27 hours. And there's some really interesting information and some really interesting stories that build this up into much more of a case on CNN. So in this case, it was pre-surgical planning. So pre-surgical planning can be used for a number of different things. First is confirmation of the surgical approach. So once you have that CT data, you can start to think about what's going on with the kids and where are we even going to start cutting this. The surgeons that are doing this level of surgery kind of know how to do this, but this just provides an additional step, an additional measure of support. The surgeon that was set up to do this surgery has done 7 of these, I believe. So he's reasonably familiar on how it works, but he decided that this would be a useful application for these tools. So it creates the skulls, understands where the pins are and bits and pieces like that, understands the brain matter, where the vasculature is. That can then be used with surface scanning to create models of the kid's head. This is really eerie technology, but it's really very important because it helps the doctors understand as they separate the kids, how are they going to put their heads, how are they going to position their heads, how are they going to hold them in the operating room so that they've got good access to the circumference of the skull, things like this. And you can't do this with the boys, obviously. Like that's just not possible. It also allows you to see the 3D model of where the vasculature is. So it allows you to look through the flesh and through the brain matter and understand where the anatomy and where the vasculature of the brain is, and if you cut too deep, what you might be cutting into. So it gives you a little bit of transparency, if you would like, see what's going on. If you were doing a different surgery, you'd also be able to pre-bend the items that you'd be affixing to the skeleton. So rods and plates and things like that are currently, in many cases, bent in the operating room because that's the only place you can actually check whether or not they fit. It makes sense. You don't have to do that anymore. You can produce a 3D printed model of a patient and then actually have a template to do this work outside of the OR, reducing operating room time. And then this is another reason why it's important, because when you've got a team like this, which is, I think it's pretty small by complex surgical procedure standards, but nevertheless, you get a sense of how congested the room is. How do you convey clarity of action to your colleagues in such a complex case? In this case, it allows you to point out what's literally going on. You know, I'm going to cut here and do this, and then we're going to rotate, and then we're going to come and do this cut. And that's part of what you'd be seeing here. There isn't much data to support the use of patient-specific models. Interestingly, again, the field has really only been active for maybe 10 years. There's documentation of models going back to 1990, but as an active field where research has been going on in it is much more recent because the software hasn't been available in the US. General thought, though, is that it makes sense. If you know what you're doing, it makes it easier to know what to do. So reduces time in the operating room, pre-bending, things like that. Reducing complications, again, this is related to understanding what you're doing before you're walking in. There's less of I've heard the word oops moment, which is just a reality of medicine. So everybody, I hope, understands that medicine is an art as well as a science. And it appears to improve surgical outcomes, again, because the surgeon is able to confidently do what they need to do with the assurance that they have a good sense of what is going on with the patient's anatomy. It's most impactful for complex cases like the case you just saw here, but it's also useful for slightly more mundane cases where it's not quite clear what's going on. It all depends. Ultimately, it's about the outcome of these kids. So this surgery passed off well, and then the most recent update I saw from March was that the kids are doing just great. There are a couple of other uses that you wouldn't necessarily think of. Not every patient and not every family has a medical degree, so it's quite difficult to understand what's going on, especially if you have a complex anatomical issue. These models essentially allow you to put into the hand of the kid or the parents an example of what's going on and say, this is the problem here, this is what we're going to do about it. There's also this issue of destruction as a symbolic gesture, which is if you have a cancer, you're not going to have access to that tumour once it's been cut out of you. You don't have that cathartic moment of tossing it away. There have been a couple of cases where cancerous objects have been printed and then given to the kids, and they've just essentially wanted to take them up to the roof of the hospital and throw them down. And that's been an active symbolic gesture of overcoming the disease that they've had to live with. Clinical education is another component of this. This is one of the hearts is out there from the array that we've got here. This series of models on the left-hand side was created by one of the radiologists, technicians, director of radiology research called Seth Friedman, in collaboration with a cardiac radiologist called Sujatha Budi. And they've worked on producing these models so that everybody can have an understanding of what the different types of cardiac anatomy might look like. These are all different types of cardiac malformation. Again, the ability to print various objects so that people can learn from them is a huge component. We don't need to keep things in formaldehyde jars as often now. This is what we're doing, just very quickly. This is a little bit of what's going on in the lab and shows you some of the applications and movement of the technology. How are we doing? So this is on Facebook if anybody would like to rewatch it, but it's an example. So this is Dr. Steve Sessler He's one of the cardiologists at Seattle Children's. And Steve came to us with a problem of wanting to recreate rubber hearts. What you're seeing here is some of the post-processing work that's going on, essentially vacuuming off the powder and then blowing it away into a vacuum system so that you end up with the final artifact. And then we add off-the-shelf additives to infiltrate the rubber, and away you go. You've got a rubber heart that you can then put a catheter into and get a feel for before you conduct the surgical procedure. And this is Steve Sessler's interest in another electrophysiologist at UW called Chris Patton. And we're going to touch a little bit more on their work in a minute. The idea of this is, the interesting thing about this technology in general, not the 3D printing so much, is that it's about putting the cardiac simulator in the operating room so that the electrophysiologist actually has a real sense of operating, because the patient has a sheet over them anyway. So what we've done with the simulator is create it in a way that you can actually put it on the bed in the operating room and use exactly the same tools and exactly the same imaging systems that the surgeon would be utilizing. Can we get past that? Maybe. Yes. All right, and this is another case of what has been done at Seattle Children's utilising 3D printing. So Cami Sutton, this is all information that's available on the web, so I'm not using any protected health information. Everybody here, in theory, signed the consent documents that they need to sign. So Cami, as a patient at Seattle Children's, she was born with a very complex congenital heart. Essentially, her heart was turned backwards and on the opposite side. 19 surgeries, not great options, heart transplant. But the electrophys team and the cardiac team decided maybe there's another option here of using a double lead pacemaker to address some of the issues and maybe stabilize her heart. And what I'm going to show you is hopefully a quick video of a section that was associated with Seattle Children's work on just additive technologies and advanced technologies in general. So we'll see if this works.
The plan for Cami is to give her a second pacemaker that will help synchronize her heartbeats.
What Cami needs is a different way to have her heart paced.
Because right now I'm only having, the pacemaker lead is only going to the right side and the left side's beating later. So we're losing some heart function because of that. So it's looking like if they do this new pacemaker and it works, I could have better heart function and better quality of life.
We thought that this technology might allow it to be possible.
But here's the problem. Cami's anatomy is so mixed up, it's hard for Dr. Sessler and Dr. Patton to find the right path for the pacemaker's lead wire.
And so we're in a position where we have to be creative. There are two acute angles here that we're going to have to overcome.
It provides such a nice level of extra safety to be able to practice without the patient.
At this point, it's looking to me like the left side might be a better option.
Chris is awesome.
Again, this is doing exactly what we wanted to do. It's showing us where our problem spots are.
It's the first of many practice sessions. And if the surgeons need another heart, they can print another one.
This won't be the one and only time that we do it. You know, we've already learned a couple of important things from the model, and we've really just started.
While the surgeons practice, Cami and her family anticipate a successful surgery and new opportunities in the years to come.
Go out and do even more, maybe travel. If I can be able to come off the heart transplant list, I can travel again. And I'm really into auto racing because of my experiences with Team Seattle and Sovereign. So getting to more races and seeing friends that I don't see very often.
I'm just going to mess it
So
up.
just adventures.
So we should be okay if we go back into here. Yeah, I'd have just messed that up. I'm a Windows user, so I'm pretty useless with Macs. Healthcare innovation. Okay, so you get a sense of how, like, really patient-specific modeling is one of the really big things about how 3D printing is being utilized in hospitals at this point. This starts to track down the more conventional path of using additive technologies to support design and development of various ideas and work inside hospitals. So like I mentioned, I'm part of the Seattle Children's Imagination Lab. It's a small space within inside the Seattle Children's Research Institute, which is intended to enable people to make things. Again, the idea is very similar to the maker movement and work that Ivan does at Bothell. Children's didn't have access to this prior to us setting this up, but it meant that we were able to make things, and it's enabled other people to make things at the Research Institute as well. We have two spaces, the workshop, which you just see here. It's got a range of tools, simple bench, and then we have a machine shop which has more capabilities, including welding, CNC machining, and various other pieces like that. A little bit more dangerous, so it's a little bit harder to get access to. These are the range of printers that we currently carry online: stereolithography, binder jetting, FDM, so the plastic extrusion, and then this interesting machine on the end, the Engine SR, which is a hybrid manufacturing system that can do laser cutting, CNC, FDM, it can do syringe printing, things like that. So much less sophisticated than the work that Sam does, but the concept being, let's introduce people to the technology of syringe printing and gel printing at Children's. Here's some of the, this is a slideshow now of some of the work we do. It starts with the most simple things of just making better sample trays for histology and groups like that. Essentially, how do you manage a very difficult to handle specimen in a way? This was essentially a customized cube tray. Custom grommets for products that we make, replacement parts for equipment that are very expensive. This is for a flow cytometer, printed for a few cents essentially in replacement of a $50 part with very similar properties. Replacement of this piece down here. This was a camera holder for use in the OR. One of the quotes I heard was $17,000 to replace that, because you can't just buy the case, you have to buy the whole assembly. This isn't something we would necessarily propose because it's a question about reliability and risk, but the concept here is that we can print this out of nylon, and if we could print this out of Ultem or a much, much stronger composite, would this be appropriate to use as a replacement part for this? And that's where it comes back to the IP and the regulatory risk. These are one of the heart models, again, that Sujatha and Seth put together for us. And then, again, some of the more extreme prints that can be done. Rubber hearts to support cardiac surgery and cardiac anatomy simulation. Then we start to move on to the more sophisticated products. This is an entirely self-contained mouth plethysmograph, so it has in-chamber wall heating, it has airflow, it has many different things. Again, just printed as a single unit, 2 units I should say, and then FDM printed levers to help eject the door. Rotary molders to assist with the production of rubber hearts. Again, 3D printed. Then we start to get into test equipment where you're dealing with 3D scanned anatomy in combination with 3D printed parts, in combination with mechatronic systems. Again, you start to make more and more complicated things as you get better at this technology, and eventually you start to build your own printers. This is a printer that was designed and downloaded by a gentleman over in Belgium that we thought would be a good idea, that might be worth building on our end because we want to understand what it is to actually interact with the powders without having to pull all of the powder out of our workhorse printer that is quite expensive. So one of our techs essentially led the build on this, and it worked for a while and it didn't work for a little bit, and this is one of the problems of building your own technology. But again, 3D printed parts, laser cut, water jet pieces, all off-the-shelf technology. Again, a great representation for the 3D printed build community of what can be done, and then the work of the Imagination Lab team to put this together. Next thing is point of use care, and how am I doing? Like a couple of minutes? This again touches on where Ivan was coming from, which is if we can produce parts at the bedside or at the hospital, what does that actually mean to the hospital production and supply chain? Starting off with little things to make the ergonomics of a machine easier to use. This is straight from the internet. This isn't work that we've done, but it's a good example. There is an example of an open lab part. There's a gentleman that's working on this to essentially make pieces that can be printed so that you can make your own lab equipment, bringing down the cost of lab supplies. Then you've got your surgical guides. So the ability now, using the Form 2, you can print in a biocompatible resin, which can then be sterilized, then have these metal bushings inserted and can actually be used as a drilling guide. Form, advertise, and utilize this technology to support the dental industry, which is what's going on here. There's no reason to think that that technology couldn't be applied into the operating room as well, because in some cases you're drilling, which requires the addition of these bushings, but in many cases it's a dotted line about this is where I should cut. And all you need in that case is biocompatibility to be in contact with the skin and sterilization capability. And then finally, again, the dental industry seems to be really leading the charge of on-site production in the dental clinics. But you can produce these printers now. Printers can produce full dentures at this point to replace what's going on. So your dental office, in theory, could have a machine a couple of years from now where this doesn't need to go out to a print bureau or a dental bureau to actually have this produced. It can be produced in your dentist's office. So coming back to what Ivan was going with some of his ideas and the ideas of the community, what does this mean for point of care for global health? And this is a part of my interest. My background is wheelchair design and construction for developing countries, so I used to travel around the world teaching factories how to build wheelchairs. So what if we can change up the supply chain in a way that actually enables access to not just printed prosthetics, but other components as well? So comes in a bag. This is information mostly drawn from Filabot, who produce all of this technology. Goes into a hopper. That hopper then extrudes a filament. This is all pretty simple technology. So the entire system you're going to see here is about $6,500. That then goes onto a spool, and that then goes into your printer. Now you can start to produce parts for people. So we ran into an issue in Kenya where one of the flow meters that we needed to provide air to a patient didn't fit the wall, didn't have the right connection to the wall, much like the HDMI problem actually, but a little bit less technically difficult to solve. What if we'd been able to produce that part at the hospital so that they were able to use the right flow meter to provide the right flow to the patient? You know, what would that mean, and how easy would that be using this technology? Pretty easy. Same thing when it comes down to the prosthetics. If you open up their store about the production of these devices at the hospital or at the clinic, what does that mean? How do we ensure quality? What do we do about that? But it's possible. Like this is technology that exists now. And then when you're done with all of these parts, you throw them back into the hopper and you turn them back into pellets, and the whole thing starts again. So this is a interesting idea that changes the whole way that the supply chain for making things in developing countries can even happen. So I think we're running to the end now. Really, this is the Imagination Lab, and all the work we do here is a community project. It's not mine. I'm a custodian of these resources. I work with Tom Hansen, Skip Smith, Peter Richardson. These are the PIs essentially that got the lab on its feet. Jeremy Ford, Larissa and Ty are part of the team that help us get things done. We work across the organisation, and that's kind of the point. We're a community initiative. And then we're funded in all kinds of different ways. If any of you would like to figure out ways to interact with us more, you can contact me this way, or you can also just contact me at christopher.howard@seattlechildrens.org. And other than a lot of references, because we're being recorded and put on the web, yeah, we're done. Thanks very much for your time.
Thank you.
Yeah, that's right.
Thank you very much.
Sorry.
Well, thank you very much. And in the interest of time, it is 8:30, so unfortunately we're probably not going to be able to do a panel Q&A, but I'm sure...
Sure, no, we have time.
We got time?
Go ahead. Let's do like 10 minutes.
10 minutes? People be okay with that? All right, let's do 10 minutes.
There's just one thing I want to ask, is polymers, are they one of your biggest challenges? Because you have FDA approval and all that to go through? Or what are your biggest challenges from a material standpoint or design? Or what are your biggest challenges, I guess?
Was that?
Probably everything's your biggest challenge. Oh, I'm sorry.
Sorry, was that?
Maybe everything's your biggest challenge, or I come from polymers, whatever, and I know it takes a long time to get polymers approved by the FDA.
Right.
How much playroom do you have with polymers, or is really that's not your biggest challenge? Is design or something else your biggest challenge?
Is that to all of us or just to me?
I just really overall when it comes to
Okay.
utilizing 3D or 4D, whatever.
Sure. I mean, I can start, I think. Yeah, sure. So when it comes to FDA, there's a couple of different challenges. One is if you're building something for implantation, then you're absolutely right. You have to go through that long process of making sure that whatever polymer you're using is non-toxic, doesn't degrade and release some kind of toxin. But when you're developing these tissues that are for preclinical use, so for a drug company to do their research on, then the challenges with the FDA are slightly different. You have to persuade them that the tissue you've generated has some kind of relevance to a disease, and once they see that, then they're quite willing to kind of pull it through the process. So there's a couple of different challenges there.
I can maybe just comment as well. So I think polymers are also the opportunity, primarily just because, if you look at what people are 3D printing with, they're largely the same materials like nylon, right, lactide, PVA. I mean, they're materials that have been around for a long time, but what people are trying to do with 3D printing, I think, are beyond what the current materials are capable of handling, and sometimes it's just difficult to print these materials to have the properties that you want. So, yeah, I think it's still wide open.
From a timeline standpoint, what do you think it is as far as when it really becomes almost a common day? Are we looking at 10 years out, 20 years out?
Yeah, it depends on the application, right? Yeah.
It's very easy to say.
Yeah, there's been a lot of discussion of this company called Carbon, right, and what they're doing, and that, I think that they've done a lot to advance the engineering and the chemistry, so they are able to make a broad set of polymers and materials, and I think with that comes a lot of value in their capability. So, I'm really impressed with the stuff that they're doing, and I think that means that it's in the near term.
Thank you.
Sam, I think it's Sam. I'm interested in the idea of using your own cells to reproduce organs in your body, as you suggested we could do in 30, 40 years. But one of the things I learned in a previous MIT forum was that cells have telomeres, and every time you replicate a cell, the telomeres get shorter until at some point they stop replicating. I was wondering if that is a problem for 3D printing of your own human cells. In other words, can you actually produce enough cells to generate an entire organ, or do they actually stop reproducing at some point? And is it something you know about, and is that a problem that still exists, or has it been solved already?
Yeah, that's a great question. And it does depend on the cell source that you're selecting. And so, for example, with the airway tissues, those contractile tissues we were producing, they're using cells that are taken directly from a patient, so primary cells. And they have exactly the problem that you mentioned, which is once we've sort of got them to divide several times, if they go too far, then they're unusable, and they don't contract anymore, and they lose that function. So if we were going to implant those cells, you'd have to make sure that they were still at that kind of youthful age where they could still function. And there are some strategies around taking adult cells and reprogramming them. So induced pluripotent stem cells is one technology that's looking very promising for doing that. So kind of taking cells almost back in time and being able to reprogram them so that they have that kind of that pluripotent potential. So they can turn into almost any cell type, but they also have a much extended lifespan as well.
Interesting. All right, thanks a lot.
Yeah, I have a quick question, I think, for Chris and probably Ivan. If you could talk about the use of scanners and maybe how the scanning technology is also coming up, and maybe we could look to lower costs on the 3D scanners.
I can start with that one on the realm of the low-cost scanners. So low-cost 3D scanners are, you get a lot of anomalies out of them. You have to be pretty skilled at using them to get a semi-okay result, and even then it's not something that you could use for producing a model for surgical planning or anything that you need a high degree of accuracy. But there are scanners that exist that are still quite expensive but highly accurate, and maybe you could touch on that.
Yeah, so you've got two different types, I think, of, well, excluding photometry, you've got your structured light and your laser scanners, laser line scanners. One of the interesting things about heading over to the East Coast to see what's going on in the additive manufacturing conferences is you start to see what's coming in from China. So Creaform and some of the other companies that have been producing $30,000 line scanners and structured light scanners, they've got something to be concerned about, it looks like. There are companies, first of all, that can now make their own scanners, like Vorum, that use it for prosthetics and orthotics. They have a specific type of design that uses blue structured light, so it doesn't interfere with what's going on. And it's specifically designed with a resolution to capture the anatomy of the patient accurately and compensate for movement. And then you've got the higher end metrology level scanners where you can. I saw a supplier from China that was offering a structured light scanner with significantly greater resolution than the one that Creaform's offering for $30,000. The Chinese company was offering it for $5,000, and for an additional $700 you get the rotating table. And then for another $700 you get the color feature. So for $6,400, excluding shipping and handling and tax, I suppose, you have an incredibly high fidelity tool. The flip side of that then is what do you do with this data? Okay, so I've got this incredibly high fidelity point mesh, point cloud. How do I manage that? And they had worked on that as well. But the reverse engineering component, again, this touches in on where the IP starts to exist and how, what is mine and what is open source. These questions start to emerge very quickly. So once you've got a really good scanner and you've got really cheap reverse engineering software, okay, now what?
Yeah, I was wondering if that's how you were doing some of the replacement parts that you were looking at. Were you scanning those?
We have a few options. So we have access to CT scanners, so we can always use those. I'm trying to find out how much it's going to cost to get that part scanned, actually, just because Seth's a pretty good guy to work with and a lot of fun. He knows his tools. But really, we work in SolidWorks. I'm looking to buy a $5,000 scanner so that specifically I can scan surfaces more effectively, and then that's the path I'm heading down. It's an efficiency and supply chain concern, as well as, gee, wow, this is cool technology. What else can we do with it? Yeah, it's a great question.
How you doing? My name is Jaime. I just want to say, awesome presentation on so many cool, wonderful things. It really gets the mind going, like, wow, these things are really available to us. So thank you for your knowledge and your expertise and your time. What I want to know more is, I understand the complexities of a liver and a lung. Wow, 300 million different apparatus, I forget where you called it. What are some things that are now that can be created within the human body in 3D bioprinting that can really help? Like, for instance, like a ligament. Like you talked about the meniscus earlier before. That was kind of fascinating. So what is out there that's available for the person now? We know for the future what we're aiming for, which is amazing. But now?
Yeah, it's a good question. And I think it's important to, with any new technology, kind of match reality with expectation. And it's almost impossible for me to sit here now and say, oh yeah, and reel off a list of 3D printed parts that are available, because they're not. But there's a lot of work going into this in a variety of different tissue areas. So people are working on bioprinting skin for burn replacements. And it's not available yet, but it's getting very close. And I think really it's the simpler tissues that will be the first ones to become available. So, things like cartilage and meniscus that are relatively simple structures, they'll be the first ones that are available. Bone is one sort of structure that's being printed and is almost, I think, close to being tested in the clinic. But all of these replacement tissues will have to go through a very similar testing protocol as new drugs. So, they're tested in animals first, and then they'll be tested in humans, and their trials will be years and years in length before these tissues are proven to be safe and effective. So it's a long process, and we're at the start of that process.
Awesome.
I'm curious about what your experiences have been around software file formats and compatibility. I deal in design and manufacturing, and it's the old school stuff is a freaking nightmare. And the new stuff, it's, you can't do material type, material characteristics. You can't even do color in a standard way. So do you see that as a problem for you and where you're heading? And do you see there any potential solutions on the horizon?
I could jump in on that one briefly. One of the biggest problems right now in the area of the intersection between, let's say, 3D printing and traditional engineering is that most CAD software that's dealing with engineering file types does not do well with mesh files. So like if we're taking a CT scan and generating a complex model of anatomy, importing that into SolidWorks is a nightmare. And so I'd say that that's one of the challenges. There's some software companies that are trying to tackle making that process more smooth, but presently that's a significant challenge.
Yes, really?
Very last question.
It's just a 15-part question. Thank you all. It's really amazing work. So I have really a 15-part question, but I'll try to make it relevant to a New York Times article I saw yesterday about these women that had breast implants. I'm sure that's going to be the first thing to get money for the capital for all the other stuff, right? But the difference between a capsule that was smooth and a capsule that was rougher, there was these biofilms and bacteria, and this was causing cancer because its impact on the immune system. And so I'm thinking about the sheath, for example, with your project, and fascia generally within the body through each organ. How are you guys approaching the capsule or the fascia or even the sheath and the material and how it interacts with the immune system?
Okay. It's certainly a problem to kind of take into account. Biocompatibility of the scaffolds we use means a couple of things. One is if we're printing cells into those tissues, then that polymer has to be biocompatible in the sense that it supports the growth of the cells within it. But then you're absolutely right. Once you implant that tissue into the body, that body's going to have some kind of reaction to it. Our goal is to trigger that transplanted tissue to engraft and encourage the ingrowth of blood vessels and basically knit into the existing tissue of the patient. And adding in specific growth factors into the scaffold that trigger blood vessel growth, anti-inflammatory sort of factors that can dampen down the immune response. These are all strategies that are open to us from a cellular perspective.
Well, I think that's it. So thank you again to all of our speakers today. This concludes not just the program, but also our season of programs about transforming tomorrow. And so we'll see you all in September. Take care.